Most people have either had a root canal, know somebody who's had a root canal, or they've heard the horrible stories of somebody else's root canal. But they really aren't as bad as they sound. So I've worked in an endodontist office now for about 5 years. So an endodontist does root canal treatments. That's all they do all day long, every day. So I've learned a lot about root canals. One of the biggest things I've learned is they really aren't anything to be afraid of. So I'm going to try and share a little bit about what a root canal is with you, and hopefully knowledge is power, and it helps you not be intimidated later on if you need a root canal. So we're going to talk about some statistics, the symptoms that might indicate that a root canal is needed. We're also going to talk about the actual procedure of the root canal, what happens, and then what to expect after that root canal is complete. So let's start with some numbers. According to the Kaiser Family Foundation website, there are about 200,000 dentists in the United States. If we check the American Association of Endodontists website, we find that about 4,000 of them are endodontists or root canal specialists. That's about 2% of the population. So a very small group. But they're the ones that take care of those tougher root canals that your general dentists don't want to touch. There are about 15 million root canals done annually in the U.S. That's a huge number. 76% of the people surveyed by the American Association of Endodontists indicated they'd rather have a root canal than an extraction. And who doesn't want to keep their natural tooth rather than go through partials, bridges, dentures, implants? You can keep it with a simple procedure. It goes a long ways, especially down the road. The American Dental Association did a survey. They do one every year on dental fees in America. The last one that numbers are available for is 2013. In this survey, they determined that an average root canal in the U.S. is going to cost between $700 and $1,200 per tooth. And in many regions, it's going to be much higher than that. Depends on the cost of living in the area. It's going to cost more with the specialist, with the endodontist, than it is with the general dentist. Just some numbers to be aware of there. So now that we know a little bit about the numbers, let's take a look at what symptoms indicate you might need a root canal. Nice pretty little girl here, she's hurting. Some of the things that indicate a root canal might be necessary is a throbbing pain, when you feel that heartbeat in that tooth and it just is relentless. Another thing is a strong lingering ache around the tooth or the jaw, especially after you've had something cold or hot and it just hangs out there for quite some time after you've removed the stimulus. Biting sensitivity, that sharp pain when you bite down on something, and also swelling in the gum tissue, in the jaw, in the cheek. All of these things, especially when they're long-lasting, can indicate that a root canal is needed. So then you go see your dentist. Now we know what some of the symptoms are. How do they actually do a root canal? What is a root canal? Some people, when they come into our office, they say, am I still going to have a tooth when I'm done with this root canal? They don't know what's going on, and that's part of the fear. So let's take a look. On the right here, we have a vital tooth. It's got the blood flow, comes in through the tip of the root, and keeps that tooth nourished. On this side, we've got a diseased tooth. It's got a cavity at the top. It's got an abscess at the bottom. There's no longer any blood flow, and there's bacteria leaking out of it. This is the tooth that needs a root canal. When we take a look at what the dentist does, he drills an access opening in the top of the tooth, just like he's filling a filling, cleaning out the decay before he can make it better. He's going to clean out all of the stuff in the chamber and in these roots, in the canals, getting rid of all of the tissue, cleaning and shaping the structure to make sure it's down to good, clean, healthy bone structure. Once he's got that all cleaned out, he's going to put in an inert material, which is called gutta percha. This material is going to help prevent bacteria from reinfecting inside that tooth. It's going to take away the flow of bacteria to this abscess so that this can start healing on its own. Your body heals your root canal problems. It's not necessarily the medicine you're given. If you're given an antibiotic, that's to treat your symptoms. It's not getting rid of this. So your body is healing that once the dentist has created an environment where it's possible for it to heal. Up at the top, we've got a temporary filling, and that's because we don't want you causing a lot of trauma to that tooth, so we keep this filling very low, below the chewing surface, so that for the next couple of weeks, your tooth can have a healing time. After a couple of weeks, you're going to go back to your general dentist. Let's get back here. You're going to go back to your general dentist. They're going to take that temporary patch out, and they're going to finish that root canal with a permanent filling or a crown over the whole tooth in order to help it sustain a good, long, healthy life. So we know the symptoms of a root canal. We know the process of the root canal. Well, what are you going to expect after it? So doing a root canal is trauma to your tooth. It is going to be tender and sore for a few days after that visit. Usually over-the-counter pain relievers is enough to take care of that. Also, you don't want to chew on that tooth. You still want to continue chewing on the opposite side so that you're not adding any trauma to that tooth while it's trying to heal. And then it looks like this. You've gone back to your general dentist, you've had your crown or permanent filling done, your abscess is all cleared up, which can take 6 months to a year to show on an x-ray. But your symptoms have resolved and you're a much happier person. So, we've seen how the numbers match up. Root canals are pretty common at 15 million a year. We've seen that the symptoms can be kind of severe. Nobody really wants to have the symptoms of a root canal needing to. But the process is straightforward. What you feel and hear during that process is very similar to anything you're going to feel while you're having a regular filling or a crown preparation done. So you don't really need to be afraid of it. And then, excuse me, what you do afterwards is just to make sure that you baby that tooth for a while it heals. So we have all of that information, and hopefully you won't need a root canal, but if you do, if you're one of those 15 million root canals that needs to be done, hopefully you have a better understanding of what a root canal is,